good.
Do I start now?
Mm-hmm.
I'm on?
Yes. You're on.
Hi everyone, good afternoon and welcome to our first Facebook Q&A. My name's Deanna. I'm the clinic manager for Zoo's Neuro Acupuncture and Rehab Center. I just wanted to let you guys know in this Q&A, Dr. Moyee will be going over questions that were submitted to us via the survey that we shared with you guys last week. So there's quite a few questions that we received, so we will try our best to get to all of them. We may not be able to get to any new questions this time because of the amount of questions that we have, but we will do our best to answer any additional questions. If we aren't able to get to them, please feel free to send us a private message and we will add them to our next Q&A. Just want to let everyone know that the people that ask questions in this Q&A session, please make sure that you have a basic knowledge of Zoo's scalp acupuncture prior to asking a question. And with that said, let me introduce Dr. Moyee Siu.
Hello, good afternoon, ladies and gentlemen. Welcome to our first Jewish Scalp Acupuncture online Q&A section. My name is Moyee Siu, and I've been working with Dr. Jew for more than 20 years, starting as an apprentice, following him day in and day out, treating patients and doing house calls and going to the hospitals to treat patients. And then later on, we co-found our current neuroacupuncture center. So I had the opportunity to learn and watch firsthand from this amazing master. And I feel very grateful for that. So my goal now is to have Dr. Jew spread this valuable knowledge and share them with as many practitioners as possible so that they can go out and help more patients. I don't promise that I will know all the answers to your questions, but I will answer them to the best of my knowledge. And if I have anything I cannot answer, I will ask Dr. Jew. Okay, so first, let me share with you some recent news about Dr. Jew, because some of you asked where he is and whether he is returning to us. Dr. Jew is now in China. He lives in Shanghai, but he always travels to different cities in China. He spent most of his time teaching small classes, big classes, trying to establish relationships with hospitals and doing some research studies. So here, let me show you some pictures, okay? This is me and Dr. Jew. This is Dr. Jew giving a talk in China. His most recent class is May 26th in Yunnan, a very big class. He's also treating patients, doing demonstrations, and also having some fun time. Yeah, okay, good. He has to wait until the pandemic is over before he can return to us, okay? I will let you know then. Now, let us start our questions now. Okay, I have divided questions into two groups. The first group is about the basic theory and procedures and techniques, okay? Because you need to lay a good foundation before you can have a good clinical applications. The second group is about clinical applications. How to treat this or that, okay? So let us start now. Question, number 1.
Question number 1. Dr. Zhu told us a couple of times that after putting needles to hundreds of heads, you start to understand how it works. I've noticed lately that in some patients, the needles go in very smoothly and easily. I found a couple of heads or areas in some heads that below the head surface, it feels very dry. And in those heads, the needle insertion becomes more difficult. Can you talk a little bit about that? Is this somehow a scar tissue, although there is no apparent scar?
Yes, it is true that some heads are easier to needle and some are not, regardless of how gentle you are or how thin the needle is. So is it due to the scar tissue in the head? Remember that the scar is formed only after an injury, as the body tries to repair the tissue. So if there is no injury or no surgery, then there shouldn't be a scar. So then why are there differences in the difficulty of needling? So first, let us look at this diagram. This is a diagram that shows the 5 layers of our scalp. The first layer is the skin, where hair grows. So you see the epidermis, dermis, the hair follicles, sebaceous glands, and sweat glands is in this layer. It is relatively thick, about 3 to 8 millimeter. The second layer is called the subcutaneous connective tissue layer. It is a dense fibrous layer where you find the arteries, veins, lymphatic vessels, and nerves. This layer is about 4 to 7 millimeter thick. The third layer is called the aponeurosis layer. It is relatively thin. It's only about 1 to 2 millimeter, but it is very tough and elastic. It's a flat sheet of fascia that joins the occipital muscle in the back of our skull and the frontal muscle in the front. So it's actually spread across from the back of the skull to the front, from the superior nuchal line to the eyebrow. The fourth layer is called the loose areolar tissue. It is more spacious, right under the aponeurosis, about 1 to 3 millimeter thick. And then the last layer is the pericranium, which is the membrane over our skull bone. The first 3 layers, the skin, the subcutaneous connective tissue, and also the aponeurosis, are firmly attached to each other. So sometimes they constitute a surgically single unit. It's hard to separate them. So note that every one of us has the same 5 layers, but the thickness of the layers and the density can vary from individual to individual, and that's why some heads are harder to needle and some are easier. In general, you will find that bald heads are tougher, okay? And then also, if you have a chance to treat patients in the hospitals, you will find that some of their heads or scalp are very soft and spongy. So these actually indicates that there is some edema in the either epidural or even intracranial. You can find these on patients that are in a coma or have a traumatic brain injury, some kind of brain infection like encephalitis or meningitis. So it indicates local swelling or intracranial edema, sort of like there's so much fluid inside that it overflows to the scalp, because we have emissary veins that actually connects the interior of our brain to the outside of the scalp. So this answers why different people have different difficulty in needling. Okay, so let's go to question 2.
Question number 2. How a big scar affects the possible impact of the treatment in the scalp.
Okay, scar tissue is usually fibrous, so of course it's harder for the needle to penetrate and it will cause more pain. And because it's tougher, so it's almost impossible to do any kind of manipulation like lifting and thrusting. And also remember that they are not normal tissue with normal blood supply or nerves. Therefore, certainly scar tissues will affect the effect of our treatments. So always avoid needling scar tissues unless your purpose is to loosen the scar.
Question number 3, direction and depth of the needle.
Okay. First, let me start answering the depth first. How deep should the needle go in? Always remember that we are talking about the tip of the needle, okay? And not where the insertion is, okay? The tip of the needle. We should insert the needle until theoretically until it reaches the 4th layer, because it is a loose, more spacious area. However, because we don't have any camera or MRI, we have no idea whether the needle, the tip of the needle really ends up there. But it doesn't matter because we can use our own feeling, the feel in our fingers. Okay? We have to feel that the needle is not too loose or too tight. That means you get that what we call the dirty sensation. And you should feel some kind of a suction in your finger, okay, trying to pull the needle in. So if you get that kind of sensation, it means that it's in the right depth. Then how about the direction? The direction depends on a few things. Depends on which treatment zones you are treating. Okay. So let me talk about, there are a few rules of thumb. Okay. The most important thing to remember is always point the needle towards the target. For example, if you want to treat your nose, which is mapped on the scalp at 24, the center of head and face. So you should insert the needle either superior to 24 or inferior to 24, because in this area you can direct the needle either from the back to the front or from the front to the back. Okay. So how do you decide which way is better? Well, you should consider a few things. Number one is safety. For example, if you needle your from the front towards the back, then what happened? The needle will be sticking out of the head, so the patient will be always seeing something hanging over his eyebrow. Okay, first it doesn't look very well, not very nice. So you have to think about the look on the patient, and also it's not very safe because if the patient bump into something, the needle will be, bent. Also, for example, at the back of the head, if you are needling the occipital area, always try to needle downwards, because if you needle upwards, there is a possibility that if you needle too deep or careless, then you may be, penetrating into the brainstem, and that is not safe at all. So try to consider safety. The next thing to consider is whether it is convenient for you to manipulate the needles. For example, if you are right-handed, and you always manipulate the needles with your right hand, then you should stand at a certain position to do it more easily, more naturally for you. If you reverse the direction, you will find that you have to kind of twist your wrist, and your manipulation will be very awkward. Okay, so all these can be taken into consideration. But generally speaking, there are some, certain directions that are often used. So I'm going to show you these slides. Okay, I draw the black arrows here to indicate the directions of the needle. For example, in the head and face area, the direction is always downwards, as I said, because you don't want the needles to stick out and get bumped. Okay. All along the dual channel, in the jowls, upper jowl, middle jowl, and lower jowl area, you can needle either towards the front or towards the back. It doesn't matter. It's up to you. As long as the tip of the needle reaches your target or even go past the target. Okay. So on the back, always try to needle back downwards. Okay. On the sides, for example, on the frontal temporal area, you can direct the needle horizontally towards the back, or obliquely just like you are needling stomach 8 towards the temple. Then in the auriculotemporal area, there are also 2 options. You can needle it downwards towards the ear if you are treating ear problems, or you can needle it horizontally along the GB channel if you are treating, for example, migraine. And then in the occipitotemporal area, always needle downwards. In this diagram, you have some treatment zones along the hairline. Again, theoretically, you can do it either up or down, but for safety reason and also for the look, I recommend pointing from the back towards the front. Unless you are trying to do opposing needling. Opposing needling is used when you have a more acute kind of pain, and you want to enhance your effects. For example, in the upper abdomen area, if you have abdominal pain, you can use opposing needles. So 2 needles, one facing from the back to the front, the other from the front to the back. Okay, I hope this is clear. Now let's go to the next one.
Question number 4. Do you think that the dew points are changing locations on the dew line with time? As soon as we get older, our hairline moves backwards or even disappears. Does the location of head and face or any other area might be different in some scalp anatomy?
Yeah, well, remember the scalp diagram that we just studied. The hair grows on the top layer of the scalp, and it is the most visible thing. Therefore, the hairline defines the boundary of our scalp. Even as we age and our hair falls off, the hairline recedes, but the rest of the scalp is still there. All the underlying layers are still there, right? So, which means that our treatment zones are still there. The dew line is still there. All the acupuncture points don't change. So, even if there is no visible hairline or the hairline is, has receded, it's okay. We can use imaginary hairline. How do we find the imaginary hairline? It is measured 3 chuyên above the eyebrow. So use your hand, 4 fingers, to measure 3 chuyên above the eyebrow, and that will define the hairline.
Question number 5. How to determine which condition needs strong, medium, or gentle stimulation?
We use gentle stimulation for calming or to produce an inhibitory effect. For example, if you want to treat insomnia, anxiety, you want to calm the patient, then you use very gentle stimulation. Or somebody have pain, okay? Of course, it's better to calm the patient. The pain would then reduce. For example, like trigeminal neuralgia, okay? Very, very gentle stimulation. Another example is epilepsy, also needs very gentle stimulation. Kids with ADHD, also you need them to quiet down. In other words, any situation or condition that has excessive yang energy, you can use gentle stimulation to reduce the excessive yang. The opposite of inhibitory effect is what? Excitatory effect. So you use strong stimulation if you want to excite someone. For example, to treat paralysis or numbness, or somebody who have hypofunctions or cognitive impairment, or somebody who is in coma. So you want to excite them. So any condition that shows an excessive yin energy, too much yin and not enough yang, then you use strong stimulation. For things in between, or when you don't care whether it is excitatory or inhibitory, then you use medium stimulation. Not too strong, not too gentle.
This is a very important question. Question number 6. Why is Dao Ying important for ZSA therapy?
Oh, wow. Of course, it's very, very important. In fact, it is one of the 2 essential elements of Jewish scalp acupuncture. Remember the formula. ZSA equals needling plus Dao Ying. Without any one of them, you will not get good results. Dao Ying is very important because it encourages the patient to participate actively in its own healing. You change his role from a passive role to an active role, and so that they be aware that if they want to recover, it needs not only the doctor's work, the doctor's treatment, but also depends on the patient's own effort. The second reason is when we put our mind, concentrate our mind on the act of the Dao Ying, it will guide the qi to the to the intended target, and so we will get better result. One thing I want to clarify is Dao Ying is not just PT. PT, physical therapy, is only a very small subset of Dao Ying. People use PT to treat usually musculoskeletal problems, but Dao Ying is for anything. Any condition has its own Dao Ying. So we actually have a lot of patients who have been treated with physical therapy for quite some time, and they still have to come and get our treatments because it shows that PT is not sufficient to produce the results. But when you combine our scalp acupuncture treatments with appropriate Dao Ying, it really enhanced the results, and people are often very impressed. Another thing that you have to remember all the time is that Dao Ying must be done with scalp acupuncture simultaneously. That's extremely important. Okay. I have seen a lot of practitioners who insert the scalp needles almost like a kind of routine. Okay. As after they insert the needles, they just leave it there and then immediately jump into other things or send the patients to the PT. This is not Dr. Ju's Dao Ying. Okay, because Dr. Ju emphasized that Dao Ying and scalp acupuncture have to be done simultaneously. So if you are a solo practitioner, then you can manipulate the needles and also do some of the Dao Ying at the same time, or instruct the patient to do the Dao Ying at the same time. Okay. If there is Dao Ying that you cannot do or require some assistance, then you can ask the patient's caregiver, or if you have other hired assistants, you can do that. But no matter what, they should be done simultaneously. Of course, Dao Ying usually takes a long time, whereas the needling and manipulation may take only a few minutes. Okay, so you have to do the manipulation and the Dao Ying for like 5 to 10 minutes, then stop. But the Dao Ying doesn't stop. Okay, and then after a while, you go back to a second round of needling and manipulation and so forth. Okay.
Question number 7. Why sometimes when using scalp acupuncture to treat pain, the pain comes back almost immediately after needle withdrawal?
This is actually a very interesting phenomenon, and it's quite common in Jewish scalp acupuncture. So to understand that, we have to look at the pain pathway. The pain signal is communicated from a peripheral sensory nerves to the spinal cord, and it synapses with the second order neuron and then continue to ascend to the thalamus, which relays the signal further to the sensory cortex and other brain areas that involve emotions or decision making or memory. So when the central nervous system receives this pain signal, how does it respond to the pain? It responds to the pain by sending descending signals to release endorphins. Endorphins are natural opioids like morphine. These biochemicals can inhibit the ascending pain signals, and so there is less pain perceived in the central nervous system. So that's one way of reducing pain. The other way is to modulate the pain at the dorsal horn where the sensory nerve enters the spinal cord. So if there is a second pain signal, it can intercept the first signal and stop it from ascending to the brain. This is called the gate theory of pain. So when we retain the scalp needles in our head, it may be causing the central nervous system to continuously release endorphins, or peripherally to close the gate of the original pain. And then when you take the needles out, the gate opens again. Okay. That may be the reasons why there is such phenomena. So does it mean that scalp acupuncture has only a temporary effect? Actually, no. Because according to Chinese medicine, acupuncture affects the qi and blood flow in the meridians, okay? And it is through the actions of the meridians that our body heals. Okay? That is how Chinese medicine explain the functions of meridians. It helps the body to regulate itself and restore balance. This actually can be explained with bioscience, because if you look at the pain fibers, it's actually very amazing, because there are 4 types of pain fibers: A alpha, A beta, A delta, and also C fibers. A alpha fibers carries proprioception sensation. A beta fibers carries sensations of muscle tension. And both A alpha and A beta fibers, they are myelinated and they are pretty thick. And because they are thick and myelinated, that means the signals are very fast. Why do we need them? The purpose of these fibers is to provide very vital, important information to our brain, especially the cerebellum, for us to perform precision movements. Because every moment we have to stay in balance, we have to make sure that our movement is coordinated and so forth. Okay, and so this information requires fast signals. Then there is the 3rd type of fibers called A delta fibers. It is also myelinated, but it's a little thinner, okay, but quite fast too. Not as fast as the other 2 types, but it's still fast. And it carries pain and temperature sensation. And what's the purpose of this A delta fibers? They act as alarms. It's a protective mechanism to tell the brain that, hey, we are in danger. We may have an injury or a potential injury, and so we have to withdraw from this danger. Okay, so it is a protective mechanism. Therefore, this signal also have to be very fast. Okay, and the pain that is produced is a fast pain or a sharp pain. C fibers is quite different. It is not myelinated, and because of that, it's very slow. Why do we need something that is slow? Okay. Because it carries different information. It carries different types of signals like pain, temperature, itch, light touch, chemical or mechanical sensations. Okay. So when I treat patients, neither a patient, I always ask them, tell me if you feel sharp pain or dull pain. Okay. I only want a dull pain, and I don't want a sharp pain, because the sharp pain is the pain carried by the A delta. Okay, that is not the effect that I want. What I want is the dull pain carried by the C fibers. This information is carried by the C fibers to the central nervous system. For what? The purpose is to help the body to regulate its functions and restore internal balance. And that is what we say in Chinese medicine, that qi sensation. Okay. Also, what's unique about Jew scalp acupuncture is that when we use it to relieve pain, we make our treatment more effective by integrating with Dao Ying. For example, stretching of the muscles or calming of the mind, etc. Okay, so it is not just through the action of the needles, but also through Dao Ying. Next.
Question number 8. I have a couple patients that report a generalized numb feeling in their head. Have you treated or can you explain this symptom?
Okay, the following questions is all about clinical applications of Jew scalp acupuncture. This question here about numbness in the head, I don't think it is very common. At least I don't see this a lot. I think it's probably due to circulation problem or some kind of swelling, some kind of compression of the nerves on the scalp. So how can we treat that? I would suggest using local ashi points with scalp needles.
Question number 9. What are the most effective points to get stroke patients to start extending their fingers on command?
The fine motor control of the fingers is actually the most challenging in stroke rehab. Restoring motor functions in the lower extremities is a lot easier, okay? But when it comes to fine motor control of the fingers, it's very difficult because of the number of muscles involved and the nerves and tendons, etc. How can we help the patients to open up their fingers? You can try a few things. One is to, of course, you have to use the upper limb area on the scalp, and then at the same time you can try small intestine 3, but you have to needle pretty deep towards LI4. Another and give it a strong stimulation. Okay, it's not very pleasant. Sometimes can be painful, but this strong stimulation can sometimes trigger the finger to open up. Another point you can use is actually a master tones point called Mu Huo. Mu Huo is the phalangeal joint, the distal phalangeal joint of the middle finger. You can use a fake needle and poke the joint. Okay, it will produce a very sharp pain, cause a reflex, and the needle will open up. When you use these points, small intestine 3 and Mu Huo, you can produce a passive opening of the fingers, and it's unfortunately very short-lived. Okay, it won't stay very long. Okay. So what can we do? Actually, I have tried for many years to solve this problem using different kind of stretching, trying to learn from some PT, and also find all kinds of tools like tying onto splint or using some springs or different kinds of things. Even electrical stimulation like bionics equipment. But I find that all the tools are not very effective. And then over the years, I I find from my own experience a way to actually help the patients to loosen up. And it is entirely my own personal experience. Okay, but I'll be happy to share with you. You can try it to see if it works for you. Let me now do a demonstration. So Diana, would you please come
Yes,
forward?
definitely.
Do you need to go on video, Dr. Moyee?
Oh.
It's okay.
Go on video, Dr.
Can you plug that in? Okay.
Yes. So usually I will start with the most proximal joint of the upper extremities, which is the shoulder. Okay. So imagine that this patient has a lot of spasticity and tightness. Okay. And so I start with here. Okay. And holding her arm, I will do some circular motion. Okay. Very, very gentle. Okay. Start from small circles and then gradually increase in range. Okay. You can also do, some massage, trying to work out some tight spots. Okay. Like that. Okay. Keep on doing until you start to feel that, okay, it becomes looser and looser, and the range becomes bigger and bigger. Okay. And then once you achieve this, then you can go to the next joint, which is the elbow. Again, you can like that. Okay. Always use circular motion. Okay, not not straight in and out. Okay. Remember, like in Tai Chi, circular motion is the best. Okay. Like that. Okay. Again, you do this until you start to feel that this tendon starts to open up. Okay. If it is really, really tight, sometimes you see the tendons tightens up as if there's a knife blade here. Okay, because a lot of contraction. Then you can needle on the tendon, okay, to loosen it up, or maybe sometimes needle on the muscle, okay, and it will also loosen it up. Okay, and continue with this circular motion, and then finally you go to the wrist. Okay, again. Okay, yeah, this type of circular motion. Okay, and then by the time you get to here, you'll be amazed that her fingers actually becomes softer, and it'll be easier for you to actually extend it. Okay. Sometimes the patients are amazed too. Okay. Ooh, my hand actually opens up by itself. Okay. Okay. If it is still tight, then you work on each fingers. Okay, like that. Okay. Yeah. Okay. Understand? Now, one time is not enough. I mean, you have to repeat this every visit with the patient, and then gradually it will becomes more and more active, and then you can starts to do some more active exercise, trying to hold something, okay, like holding a big ball, to stretch open the fingers and hold a ball. Okay, so this is just some suggestion. Okay.
You have to change.
Dr. Moyee, can you pause just for 1 minute? People are saying that it's interrupted, so just pause for 1 minute, okay? We'll resume shortly.
Okay.
Hi, everybody. We're experiencing some technical difficulties. We'll resume in about 30 seconds or to a minute or so.
Stuck.
Yeah, they're saying that the broadcast is stuck, so it might be the internet, fortunately. We may need to restart the broadcast because it's pausing too much from what people are saying.
Oh, really?
Yeah, unfortunately, the internet, yeah. So,
Oh, okay. Go to Facebook?
yeah,
You-
go to
you
Facebook. Yeah, let me.
Okay, so let's just make an announcement that we're going to restart on a new.
Can you make the announcement?
Hey everyone, we are actually going to restart in a new Facebook Live because for some reason this particular broadcast is freezing up. So join us for part 2. We're going to restart a brand new Facebook Live now. Okay, so you can end this one.
Is it just Julie or other people too?
Other people. About 5 people said that it interrupted Richie too.
Oh,
It's
what
okay.
happened?
The internet.
The internet on this end?
I don't know.
You guys already logged into hers, right?
Mhm.
Yeah,